what a joy, delight and pleasure to welcome you all here and to be part of the Labour Party conference. So tonight we ask a question that arises out of research that was conducted by Sir Dennis Stevenson and Sir Paul and Mr. Paul Farmer, which found that the workplace mental ill health costs the United Kingdom some £99 billion a year. Put in human terms, that's 300,000 people a year falling out of work because of mental ill health. Now that's a massive economic cost to the country, but it's also a massive human cost. And it's something that we need to do something about. And the question I was going to hope to ask our guest panellists tonight, what? Ladies and gentlemen, I'm going to ask the panellists to introduce themselves. So I'm going to start at the far end with Kate. Kate Dearden.
I'm Kate Dearden. I work in the Community Trade Union. We're a trade union that represents members and families in sectors across the UK, from steel, justice and custodial, logistics, self-employed, charity workers, and many more.
How did your interest in mental health arise?
So basically, two years ago, our members at our conference in 2017 decided that they wanted a priority campaign. So a campaign for the union to get behind, something that will matter to every single worker and member across our union and in their workplaces, and to make change in their workplaces. And overwhelmingly they voted on mental health. And that was a great thing for the union and something we're really, really passionate about campaigning on. And just to take you through some of the stories that we heard about the conference of our members, there was a steel worker who lost his loved one, whether it was one of our care workers who were overworked or overstressed, or a prison officer who witnessed mental distress on a daily basis in their work. It was something that matters to every single person in that room, and we as a union heard those stories at our conference and knew we had to do something about it and something to support those workers.
Switching from the union to the employer, I'm going to ask Karl to say a few words and to introduce himself.
Thanks, Marcus. Good evening, everyone. Karl Simons, I'm the Chief Health, Safety and Security Officer at Thames Water. And I think, representing the business end, I'm going to talk tonight about some of the steps that can be put in place to really how organisations can influence and create a culture of care, and what the outcome impact of that can materialise into. I think touching on good leadership, good education and good engagement, I think any employer can really make steps now that we'll see some amazing outcomes, and I'll share some of those this evening.
And then finally, Simon Blake, the Chief Executive Officer at MHFA.
I'm Simon Blake, I'm the Chief Executive at MHFA. My interest in mental health is very clear. That our organisation is about trying to improve the mental health of the nation and transform attitudes and behaviours and awareness around mental health and mental health first aid, very specifically in the workplace.
And we're shortly to be joined by Barbara Keeley. But in the meantime, do we have any questions from the audience? There's deathly silent. Lady at the back. I quickly grab one of these. Well, should we you've asked the question.
Sorry, I didn't mean to interrupt you.
You just
You did ask.
being told off for being.
We do this though.
Both over the keys, obviously. I'm not ashamed to say I've got some mental health issues of my own, and I'm going to say that out loud here because I think we need to destigmatise the question and the issues around mental health and actually make it part of normal everyday life. I wanted to ask, how would you suggest we do that? I work, and I still think there's stigma around it in my place of work. How would you suggest we go about destigmatising mental health issues in the workplace?
Actually, there we are. Probably the best point to start with. How would we destigmatise?
Should I go first?
Please do.
Great. So I'm a trade unionist, and I think that trade unions have actually a critical role in tackling mental ill health at work. Work is where we spend the majority of our time, it's where we make our friends, it's where we receive our income, and it's a huge part. And so that's the part where we spend and experience a lot of problems as well, and a lot of mental health problems at work, in the workplace. Trade unions, we stand proud of our achievements at work, whether it's making workplaces smarter, greener, and more prosperous, or tackling low pay. And for me and for the Communities Union, we know that same collective action we apply to the workplace has to be applied when it comes to mental health as well. So we don't think any worker should have to struggle with their mental health alone or in silence. And that collective action as part of the union can be extremely powerful when we all work together in tackling the stigma in our workplaces across the country. And actually holding employers to account to do something about it. And there is good practice out there for employers, and it's really, really good to see it, but it's still far behind. As you know in the Switcher comments, the amount of cost in the UK economy, how can any employer or business look at that and think that is worthwhile, or that is not something we should do about it? I think if there was anything else in the workplace that we'd dealt with straight away, and that's a huge challenge for all of us on the panel today. How can we bring employers along in our attitudes and actually create quick change in the workplace? And at Community, that's what we've been doing as part of our 2-year campaign. And we've been working with employers, and we've actually shown really good responses from some of the biggest ones we work with. So we signed up to the Thames Change Pledge, which is a really simple thing for us to do, and we encourage the employers to do the same. I think initiatives like that are quite powerful in actually getting employers to talk about it, and working with their employees to say, is this what you want us to do, and how else can we go further? So we did that, and we went further, and we created a charter for our union, for employers to sign up to, that makes sure that they tackle stigma, challenge discrimination, promote equality of opportunity in the workplace, and awareness, and that signposting was really valuable in some of our workplaces that signed up to it. But we also thought, our reps and members turned around to us and said, well, we're not sure what to do if we identify a situation, if their colleagues are struggling at work. So we've created a mental health reps guide. So if our reps are in the workplace and they get approached by one of their colleagues, that they actually have it's not the best practice, it's not all the answers, but it's something that can help them along to approach their employer and ask for reasonable adjustments and other things that might help them with work. And finally, in a way, I'm so glad to be here on this panel tonight, is because we also provided mental health first aid training for our reps and members across the country. We trained over 200 of them in various sectors that we represent. And I think that was really powerful in our employers actually working with our members and saying, this training is an absolute good thing. We've had some of our employers actually sign up to do the mental health first aid training themselves. And it's these small things that can make a big difference across the UK, I think, and actually people having the confidence and knowledge to identify if someone's struggling with mental health or to have mental ill health, and actually support them before it's too late. And I'll finish on this. Just last week, actually, one of my colleagues called me, and she identified one of our members. Didn't seem okay, he didn't seem alright. And she went on that training, and she had the ability and knowledge to identify it, and she called me about it just to check sort of what action she should take. And I thought that story was quite powerful, because it made me think, if we didn't put as much time and investment into mental health and the awareness and tackling the stigma, would she have made that call, and what would the actions been after that? So I think there's a wide range of initiatives we could do. We know it's out there, we know what's worked, and it's just getting more people on board.
Karl, what's been your experience about addressing stigma?
Yeah, so I suppose, first of all, thank you very much. Well done. It takes a lot of courage and confidence to say that openly, especially in a forum where you don't know anybody, and probably even more challenging in the workplace. Thames is a large safety critical organisation, circa 6,000 employees, 10,000 contractors working for on our behalf. So it's actually embracing the family approach in all the teams, creating a culture of care. Over the last 5 to 6 years within Thames, the work that we've done towards that, And it begins with leadership. I think the senior management within organisations, and what I've seen is them as, I guess, society starts to speak more openly about mental health. We've got sports personalities, celebrities, royals. That's affecting society. Society's being more open, society's in business. People are sharing their stories more and more. One of the most powerful things is the illustrative stories I've seen leaders share through the articles and magazines in your workplace. That then starts to make it acceptable for people to talk when they're struggling. We have mental health first aiders within our workplace. We're at 1 in 10 across the company. I have a connected community through that. I'll talk about social media later on and the impact that plays. But I guess, you know, being able to provide an environment that supports positive mental health. All too often, the minute we mention the word mental health, people default to mental illness. It's not. My mental health at the minute is very good, you know, same as my physical health, thankfully. But I think as organisations start to talk about it more, the people within the companies, it's how we equip the managers with the skills and understanding to be able to deal with that conversation when it arises. Because I think training people, and Simon will speak more about in terms of the mental health first aider training. I'm a mental health first aider and part of the leadership team for the organisation. But I think the managers, because the MHFAs are one part of their collective strategy and framework that sits behind, that creates the pathways to make sure people feel supported, can come forward. But really it's the managers understanding how we have worked quite hard. Let's take disabilities in the workplace, yeah? Just because there's a legal requirement to provide reasonable adjustments for disabilities, most people default that to physical disabilities. And we worked quite hard with a voluntary report for business recently, with government, towards introducing legislative requirements that actually start, although it's voluntary at the minute, yeah? How we move that forward into legislative requirements will evolve over time. But that was all about whether physical or mental disabilities, being able to get organisations to start to talk about that through their monthly reporting, their annual reports. Because reasonable adjustments, in my opinion, means whether it's physical or psychological, as soon as people start to mention it, why wouldn't we start to equip managers with the ability to make those reasonable adjustments? So there's a lot more that we can do around supporting people where they come up against stressors, anxiety, depression, mental illness cases, regardless of what it is. That's the negative side. But I'm very big on creating the positive environments in the workplace. So we encourage our managers to, in the leadership side, to actually look for opportunities to create improved self-esteem in the workplace and allow people to be themselves.
Simon, your moment has come.
I think it's interesting, isn't it? Because so I worked in HIV and worked at trustee of Stonewall around LGBT issues, and the stigma around those, stigma around mental health, stigma around HIV in the workplace, it all comes down to similar things that need to be done. And the first is acknowledging that it's important that change has come. And I think that we are in that time where everybody is talking about mental health. I think the risk that comes with that is some people are talking about mental illness, some people are talking about mental health, and some people are talking about well-being, and we probably need to be really clear what we are talking about and when, in order to have a shared understanding around things. But I think what we know works from all the evidence is, you know, senior leadership support and buy-in, but this has to start from the top. You can do things without senior leadership buy-in, but you can do much more when you've got that. You've got to have a culture which is positive and supportive, and those sort of core HR ingredients of good job design, good performance management, making sure that people are not doing emails at all times, you know, all the things which contribute to positive well-being. And I think we've lost sight of some of those core principles about helping us to keep well. There's then, you know, your campaigns and awareness raising. There's the training, which we need around awareness, and then actually practical things. What do we actually do when we don't know what to do, when we are faced with a new situation, when we're having conversations that we're not used to happen? How do we make sure that we navigate ourselves through that in a really positive way? And I think the most important bit about all of this is this has to be proactive. There are really simple things in recruitment, being clear that you're an organisation that takes well-being and mental health seriously, having the conversation in induction and making sure that reasonable adjustments are part of it. You're not talking about reasonable adjustments when actually there are problems already in place because you didn't do the conversations that you needed to have right at the outset. And then making sure that there's that opportunity for review and learning. And I guess the last thing I'll just say is to go back to the point about language. We all use really clumsy language around mental health and mental illness, and that just creates a culture of close down. And I think that the number of times you hear people say that it's crazy, it's insane, it's madness, it's mental. And actually there are really simple alternative words. It's wild, it's abhorrent, it's obscene, whatever language you want to use. I think we just have to get better at doing that in our everyday practice. And once we're more conscious and aware, then we've got a chance of doing that in the workplace and tackling stigma. But what I do know from starting working HIV 25 years ago is that culturally we may be in a very different place. The reality for people who often go into work is that they feel stigma and worry on a personal level. So we mustn't think that just because we're all here talking about mental health and well-being that things have changed. The tail, the time lag, and that reality and the gap between legislation, policy, culture and individual experience has to be closed all the way through.
May I go naughty and then ask for another question? Madam.
Just wait for
Wait, there's a microphone on its way to you.
Sorry. My question will be quite brief. I'm a clinical psychologist. I've worked in the NHS for 40 years, and I'm really glad you exist. I would just briefly say something which is not news to anyone here, is that in the service that I ran, which was for services, we were utterly overwhelmed, and we were constantly having to prioritise, which is a full pressure. My question that I have for you, because I'm so impressed that you exist, is how on earth have you managed to exist? Are you funded by charities, or are you funded from NHS England or something? How have you achieved your existence, given that mental health is such a Cinderella service? And in the NHS, and certainly in my many years, by the time I left, this service was in a far worse state in terms of resources than it was when I started 40 years earlier.
I see the natural silence. It's my area. The answer to that is we were originally a spin-off from the Department of Health. We were charged with trying to improve mental health in England. We're not publicly funded. We make our money by selling training services, largely to big business. But we're a community interest company, so the money, the profits that we make, we reapply to ensure that it gets out to people who wouldn't otherwise experience it. I'm not going to surprise anybody in the room to say that there has been a shortage of cash for addressing mental health. And I know there's a promise of money coming in, but as yet, I don't think it's yet found its way to the end services. Simon, do you want to say?
I don't think so. I mean, I think that the issue that we've got in all of this is that it's a case of there's always going to be a need for more, and that you've got clinical services, you've got education, you've got awareness, you've got training, and those funding. What we mustn't do is get into a war of should more money be in education than in mental health services for adults versus children, young people, and so many of those conversations go on.
I'm enormously excited because we are now joined by Barbara Keeley, who is Shadow Minister for Mental Health and Social Care. Barbara, could you say a few words to tell us a little bit about your views about mental health and in the workplace?
I mean, shall I run through what I was going to say if I'd got any more time?
Please do.
But I mean, I have to apologise if I'm going to repeating anything that anybody else has said, which is a high probability for coming on, and I didn't hear other people. And really thank you for inviting me here today, because I think this is a really, really important subject. And it's important because it could affect all of us. It could affect all of us here at Conference, not alone these people here in this room, as employees or employers. And I know you started the questions, but I'm really keen to hear what people have to say on that. I was going to start with a snapshot of where I think we are now. I think we could say that mental health, mental ill health is getting more attention than ever before, and that maybe we could also venture that more people are accepting of mental health conditions now, and that's a good thing, with less stigma. And we've seen in recent days and weeks Jason Nelson and Christopher Eccles talking about their experiences. But it's interesting, isn't it, that stress, anxiety and depression are now being seen as the biggest cause of sickness absence in the UK. But indeed, even where we know that, the picture could be much, much worse, because we've also seen a survey earlier this month found that half of workers don't tell their employer about taking mental health sick days for fear of being sacked or demoted. So it could be the traditional back pain or things which are often cited as reasons, couldn't it? But we also know that 1 in 4 UK workers has left a job because of the pressure or negative impact that the job had on their mental health. I'm sure you've actually probably already talked through these things. When we were preparing for this, we were thinking that 300,000 people fall out of work every year due to mental health. That's a population of a city the size of Newcastle. So it's a sort of staggering impact. So although it seemed, as I thought about coming here today, that there was some progress, we can point to progress. We've got a lot more to do in improving mental health support in the workplace and outside of it. I was going to touch on the Farmer-Stevenson review. I don't know if you've probably already talked about that.
We've touched a little on it.
Well, I think the thing that's disappointing, because we have so many reviews, the government is very fond of reviews, we get a lot of reviews done. But to me, we haven't seen the improvements that we need. And so I just was going to touch on 2 areas in particular that need government action. So the first is employer accountability. I know that there have been instances where employers, or often a group of employers, if you take something like the construction industry, accept that they've got very high problems with mental health amongst their workforce. But we do need to ensure that we can somehow hold poor employers to account when they don't support their employees, because we need them to change their practices and address that poor practice. So I think one of the disappointing things about the Farmer-Stevenson review is that the reporting framework for employers was not mandatory, it was voluntary. And you know, that's not good enough really. We're not getting a clear picture of how many organisations are using the framework and completing it. And without mandatory reporting, we don't know how employees are being supported. And I think, you know, it's useful at sessions like this, at events like this, but we need a much better picture, I think. Because for employees, if you were going to a new employer, you wouldn't know, you know, by being able to check whether that employer was a good employer and had a track record and would be able to have good practices and support you. And in fact, you probably have started the role before you discovered a few weeks in that perhaps they weren't. And I think one thing that's been very important of this is the Labour Party this week is the work that's being done on improvements in workers' rights. So the government is consulting on whether employees who do not fall under the protections of the Equality Act should be able to request workplace modifications on health grounds. But even that consultation, I think, falls far short of what is needed. So I mean, not only do we have reviews, but we'll have an awful lot of consultations as well. Because people who should be protected from discrimination under the Equality Act may be unaware of their legal rights to reasonable adjustments. And they could, with the new framework that the government's brought in, the voluntary framework of the Farmer-Stevenson review, request adjustments through that legislation rather than understanding that they have rights under the Equality Act. And I do think that's important. And I think improving support for people with fluctuating conditions, a recommendation for the Stevenson Farmer Review, is very important. So far the government's had 2 years to act and they're not going far enough. So I think we need to see a much bigger commitment to these issues as rights, as workers' rights in the workplace, in terms of requesting adjustments because of mental health issues. Now that is an issue that's been placed at the heart of our programme for government by Jeremy Corbyn. Earlier this month, Jeremy announced that Labour would do more to give employees support in their workplaces. Within that, I can say tonight that supporting mental health at work is a key area we're going to be focusing on. It's clear to me that we do need to do more to protect the rights of workers who have got mental health problems, both with fluctuating conditions or where somebody has a long-standing mental health condition. We need to ensure that there are mechanisms in place to ensure that those employers with poor practice who don't meet the standards of mentally healthy workplaces are held accountable. And mental health support, as with everything I cover, the meeting I've just been in and every meeting around mental health, support outside of the workplace needs to improve. But as hard as it is to perhaps get therapy treatment and therapy sessions, we need also to ensure that everyone who needs that sort of access to mental health services can do it around about work. You know, is it possible to get appointments for therapy sessions which are fitting with your working time? Well, mainly not for a lot of people. So what I touched on is only the start, I think. But I think it's important to say through improved funding, which we are committed to, support closer to home, and we want that to be an important aspect of helping people at work, and a wider range of treatments, which we committed to in our last manifesto. We thought choice of treatment was important too. I think the Labour government can bring in a revolution in our mental health. I think we can start to build a society where everyone is able to access the support they need. I mean, it seems like a pipe dream, doesn't it? Access the support you need and when you need it. But I think that's what should be our goal.
If I could pick up on a couple of things there. Thank you, Barbara. What's been really interesting, you mentioned two areas there on the start, Farmer Stevenson review. What's been really good lately is Thames Water are leading on Water UK survey that is out at the minute, which is compliance against the 6 core and 4 enhanced standards. And at Edinburgh, at the beginning of October, I'll be presenting back to my peers across the water industry the outcome analysis of that. Also, on the last month, we held a Safer Highways conference, which I chaired at the House of Parliament, which was really good, again, to launch a survey across 400 organisations across the highway sector, all now who are completing the core and enhanced standards compliance survey. And then on the 4th of December at the House of Lords, we'll be presenting the outcomes of that survey. So it's really good that you mention it, and it's what's happening is business is actually leading on undertaking surveys across industries, which is really interesting. And we're looking for more industries that we're involved in to actually to uptake this. Very simple to ask the question, how are you complying? But also within the survey, if you get a chance to have a look at it, it's very simple, because the links that within each compliance statement, so each core and enhanced standard, actually steers people towards the Mines guidance document. So the survey should not only ask do you comply, but also here's where you go to get help and support if you're not presently on that journey.
I guess the only thing that I would add, I absolutely agree, Barbara, that there's more that has to be done. What I guess I always believe is that government should always be, it always tends to be slightly behind where real innovation can be. And with mental health, there are some real examples in public sector, private sector and charity sector that go way beyond those core standards, and that's where we should be trying to raise everybody up to there. And yes, there should be compliance, but actually this is about real shift and real drive. And I think that employees and employers with trade unions, with industry-wide groups, the building construction sector has got a building mental health programme which is funded by the Construction Industry Training Board, and they're doing brilliant work in response to recognition that 2 people die by suicide every single day within that sector. So yeah, the imperative is there, and therefore we shouldn't be waiting for government. Yes, government should be leading and doing some driving, but we've also got to rely on employers and business working with partners to do so.
Kate.
Yes, thank you. I totally agree and echo everyone's comments in the panel already. And just to say, I agree, and my list for what I want the government to do is probably too long for this panel on mental health. But I think only by working in partnership, as Simon said, employers, government and trade unions were willing to tackle this huge challenge that's facing the UK. But in particular, I think we can only go so far with that. And obviously, access to more workplaces for unions is probably a key one for us to support as many people as possible across the country and work positively with employers to do that and achieve things together. And that's my issue.
Would anybody else like to ask? Ah, sir, you were first up.
Yeah, I'm a CWU rep.
I think there's a.
Yeah, I'm a CWU rep.
Sorry, what's a
the
CW?
Commercial Workers Union
Okay.
representative in Royal Mail. Royal Mail is one of the biggest employers in the country. They've signed up to lots of mental health programs. Within the workplace, they have a thing called Feeling First Class, which is a service that people with mental health issues they can call and get advice and stuff like that. But the issue within Royal Mail is I sit with people under the attendance procedure with mental health issues that are potentially covered by the Disability Discrimination Act, and they're being issued. Now, this is not helping the employer, this is actually making the mental health of the employer worse. Now, we have a procedure where you have 4 absences, that's the first stage of the procedure, and then you go to the second stage, which is only 2 absences in the next 6 months. And if you're suffering with, or over 10 days, if you're suffering with a mental health issue, the chances of sticking to that are pretty remote. So then you go to stage 3, which is when you find a new job. Now, my question is to Craig, is because, so you're from Thames Water, what's your attendance procedure? And if you've got somebody with mental health issues who is not actually, not taken to your occupational health, they don't actually class it as being covered under the Disability Discrimination Act, but this person suffered with it for longer than a year and is potentially going to suffer with it maybe for the rest of their life or whatever, would your company be sympathetic to that? And the other thing is, so I actually took a motion to the CWU conference this year, trying to get every manager or managers in every unit of Royal Mail mentally health trained. I've done the mental health first aid training, which was absolutely fantastic. But yeah, so trying to get all units to have a manager who can make decisions on people's future within the company, who has some sort of knowledge or potentially some empathy towards it. So yeah, so that's it.
All right, thanks for sharing. I think if I start with, maybe I can't speak for Royal Mail, but in terms of my own organisation, so over the last 5 years, we've had a 78% reduction in work-induced illness absence. And it's been remarkable seeing that evolve. And although absence has decreased, what we're finding is actually people coming forward has increased. So for every 1 physical first aid intervention in the last year, I have 5 mental health first aid interventions. We are at 5 to 1 in terms of people coming forward to ask for help and support. And the great thing is those people are able to stay in work when they come forward. So I don't care whether it's work or non-work related illness, absence that comes forward. Before they go off absent, if people come forward, it's a positive indicator within the organisation, not a negative. So managers get patted on the back with somebody that comes forward, they raise it, and then that individual is able to create a pathway to the right help and support within the organisation. So, it's very important to understand the context of that, because at first glance people say, well, goodness, you've got so many people, you're creating unwell within the organisation. Wrong. Whether it's bereavement, divorce, or whether it's poor management, or it doesn't matter what the issue is. People coming forward have the right to get access to help and support. We have, my rule of thumb within business is for every 1,000 employees you should have an internal occupational health professional. I have a balance, I have 6 within my company. They work directly for me in the clinical team, and those individuals are flat out in terms of supporting in the care side for those individuals that come forward. Not everybody goes to see them, but they're there as another avenue for support. Then we have employee assistance programs which work well, but the whole point is keeping people in the working environment is so important. And as a result of that, that leads to that reduction. You know, that answers your question in part, I believe. Because you know, every organisation will have differences in their attendance management policies and practices, and I think we, as a caring employer, you know, reasonable adjustments. I spoke earlier about reasonable adjustments. It shouldn't matter whether it's physical or psychological. It should be treated in the same way. Anybody with a psychological or physical health condition within Thames Water is issued with a passport, right? It's very simple, so that the individual doesn't, every time they change managers or workplace within the company, they take that with them. And it's so simple then to have a conversation with the manager saying, here's the adjustments I need as part of the organisation that's signed off by occupational health within the company. If your company doesn't have this, talk to me afterwards, connect to me on LinkedIn, we can get all that information shared, which is regularly shared. But simple tools like that go a huge way in terms of removing, because that's a big part of creating and removing that stigma around mental health.
Can I just add a couple of things to that? I guess what lots of people will perhaps we think is Karl saying this, but that's Thames Water, that won't work in other organisations, and you often hear that. But it will work in other organisations, because where there's the will, there is the way, and we know that the economic return on investment is £9 for every £1.50 spent on investing in workplace mental health interventions. And I guess it's also just worth reflecting. One of the things we talk a lot about is about having equality between mental health and physical health. 50 years ago, before there was health and safety legislation, there were about 500,000 accidents per year. With legislation and workplace interventions now, there's 70,000. What we know is that 50 years ago, people didn't manage people with cancer or long-term chronic illnesses that were physical illnesses brilliantly, but we've got better at doing so. And so it's all of the time actually thinking, how do we apply what we've learned? This isn't the first time we've had to learn how to do this, whether it's around maternity leave, whether it's about helping people who've got long-term conditions, whatever it is, we go through processes, but it's taken 5 decades to get from 500,000 people down to 70,000 people, and most of us, luckily, are more impatient for change than that. But it is breaking it down into the small steps and actually recognising there is an economic return on investment, and that's the basis of the case, which makes this both an economic and business case as well as a moral case. And Karl's really generous at agreeing to share, but I know everyone in this room will have a little thing or a big thing that their workplace is doing, and the more that we can share those, because there isn't a silver bullet to any of this, it's a whole series of different things that we've got to keep on getting better understanding. And one of the colleagues in MHFA Australia just says we've got to keep on going and, not or, should we, why. It's all the time going, if we do this and if we do this and that's what I think the spirit of Thames Water has been, certainly over the last 5 years. And I know from the work that many of the people involved with CB will also say it's that's slow progress and a number of things.
There's a gentleman I didn't manage to catch, sir.
Yeah.
Yes. Sorry, you were particularly inaccessible.
You're right. So basically, my mum suffers from schizophrenia, and she's suffered with it basically throughout my whole childhood, my whole life and stuff. And it's at the moment currently is weighted with it. It's always been through kind of different phases of different kind of issues. But at the moment, there's a lot of kind of I guess it's probably to do with paranoia is what I put it down to, around how her employers, how an employer can look into your mental health and straight away see that you have a mental health problem, and that gives her massive fears about going into work straight away. So I was just kind of wondering how the panel can address this, because the stigma's not going to disappear overnight. But she's worried about the stigma that comes with that. But also I can see how it is important for an employer to know about mental health issues as well. so that they can treat them in the workplace appropriately.
So how do you strike the balance? Who would like to come back on that? Okay.
I mean, the first thing for me is that, and thank you for sharing that. It's such a story, and thank you so much. It's a great thing to say. And first of all, it's about knowing your rights at the workplace, and the discrimination at work, especially with mental health, is absolutely not allowed and it's illegal. And that your mum would have every right to take action and defend herself in that way. But you'd hope that you have a relationship with the employer where you wouldn't have to come to that. And I agree, it's going to take a lot more in sort of rethinking mental illness and the way we talk about schizophrenia, and the way employers address it, and sort of their opinions of it in itself. I think we have a lot to do, and everyone in this room probably, in rethinking mental illness in that way. And for me, it is just about knowing your rights, and that it's not acceptable and it's not allowed, and we should not let it happen. And then from that, working together so we can change it in workplaces everywhere, and just saying absolutely no, it's not acceptable, and we won't take it in any way, shape or form.
I guess it's really worth acknowledging that we still have much further to travel where people have serious mental illness and the workplace, and that sometimes this point at the beginning about we have to be really careful what we're talking about, because talking about a well-being strategy for everybody is also different than how people manage and support people with serious mental illness. And the Farmer and Stevenson report is really clear that actually this is an area that we are not doing anywhere near well enough. And it is, until we are able to have the conversation, feel confident that the information will be used to support somebody with a serious mental illness, then you've got this sort of chicken and egg situation where the support can't put in and adjustment. So I don't think there's any easy answer, but knowing your rights is really important. Trying to have the conversations through and with the support of trade union rep or others in order to try and get the help, and finding organisations that actually want and value people with all sorts of mental health illnesses, mental health conditions, in order that we can demonstrate that everybody's able to thrive, is also an important part of that, where they've got that opportunity to do so. Sure.
Well, one of the problems is that what comes with her illness is kind of this systemic distrust in society in the first place. So it's all very well saying, you should, if you know your rights and discrimination isn't allowed, which is stuff I say to her all the time to try and encourage her and that kind of thing. But it's just that's basically all it is.
Acknowledge that, and it's not easy.
Hello. Hi, I'm Olivia from the Royal College of Psychiatrists, and we share the building with mental health first aid. Simon, you've just answered my question actually, so thank you for that. We're at the college, we're really so pleased, like so many other mental health charities, that there is this conversation about mental health. And our concern, I suppose, is this, which you touched on earlier, this delineation between common mental disorders, mental health, well-being generally, and serious mental illness. So I was interested in, actually, at Thames Water, what you kind of come across. Do you think people's understanding has followed that? Do you think people understand the difference between a manager? I know you said these passports sound fantastic, but if somebody was off ill, do you think a manager understands the difference between their stress and they just need a day off, which is completely legitimate, and actually this person has schizophrenia, like this man's mother? Is there that equity? I suspect not, but I'm interested to hear what your experience has been.
Quite the opposite, really. I think as people have shared the illustrative stories, and we've published those, we have what's called the Source magazine, which goes across our employees and our supply chain database. And in that we've shared stories of people who are suffering from clinical depression and diagnosed, and they're in work, and some days we need to make adjustments for them and they work from home if they're able to. And managers have become accepting that this is the right thing to do. And like I said, it's all about, as a leadership team, we encourage and we support managers to be able to make those reasonable adjustments in line with having good conversations with the HR representative, the occupational health professional, you know, and they're doing it. It's happening on a daily basis across the organisation. If I could just sidestep a little bit, what was really fascinating was we spoke to 70,000 school pupils across our catchment area last year. And it was all about water and wastewater services, yeah? But this year we did something slightly different. In Children's Mental Health Week, we spoke to 700 kids who were at year 11 school leaving age. And the reason for sharing this to you, when I was in one of the schools having a conversation with the children, a lot of them asked me the same question: what's social media like within business? And I was fascinated that they asked this question, because that's where the future generation is living at the minute, yeah? But I did have the answer, which was quite interesting, because we use Yammer. Some of you may use Yammer within your own organisations, yeah? And I have a connected community, thousands and thousands of people are on it. But the difference was I was able to share with them, because they were worried about coming into the workplace, being new, and whether if they publish something on social media where all the haters are, would they get feedback and would it be negative? And in fact, we use Yammer, which is 100% positive in business, in my experience. Thousands of posts, and everybody's saying likes, I like everything. And there's, but that creating that self-esteem that people are continuing to share and publish what they're doing. And from a psychological perspective, we have an open mental health forum that's monitored by my clinical team. You would be amazed at the amount of people sharing their own stories on there and how their managers supporting them, and that fuels that sort of culture, that cultural evolution that says to other managers, well, wow, this is good. And the activity on that, when it's done properly, is remarkable. From an MHFA perspective, my 500 mental health first aiders are all on Yammer. I have a connected community, and we use them as positive instruments as well to share within their teams, because let's face it, I've got one in every team now. So I use them regularly to drip feed communications and send messages into the teams of the team talks every day. So again, we're encouraging that kind of openness and sharing.
Madam.
I'm going to ask about whether it might be possible in the charitable sector or in the health sector to have some kind of mentoring system, because to prevent, a possible mental health breakdown, because I had myself a few years ago a mental health breakdown and was treated as an inpatient, and it was triggered off by extreme stress. And I've been coping and holding down a job and been off all medication and everything. But a few months ago my mother-in-law died, and then after that my mother was very ill in hospital, and I thought she was dying as well. And I was worried that the stress would cause another breakdown. So I went to the GP and asked if there was any sort of system where somebody could come around and say to me, what have you got on this week? Can I talk you through it? What have you got to cope with? That sort of thing. And she said, there's nothing at all available other than getting a private therapist. And I just think it's a huge place where something like that could be done, which would really improve things, because it would actually be much more cost effective than somebody ending up having to be treated again as an inpatient.
Yeah, I think that's just a really good example of where we want to go in terms of looking for different outcomes and therapies, pathways that might get you to that. And I think that's just a really interesting suggestion. I was going to say it didn't seem appropriate with the questions that already arose, because we also have to come up with some solution. I think everything we're hearing from Thames Water is a fantastic example, but we have an awful lot of very small organisations in this country. We need solutions where we don't have your structure, it's difficult sometimes to think through how would a very small organisation be able to do what you're doing so well at Thames Water when it would all fall to the manager or the owner of the business. That's very important. So I think exploring the different options, something like that would actually be very important. I mean, those people exist, don't they? I think people who are wealthy enough to pay for them, they're called life coaches or something like that, and people have them. I mean, I know somebody that under the Labour government had somebody in that type of role, but we have to extend that, because if that's what it takes in terms of early intervention to keep people from a breakdown, then we should look at what we can do to provide that. So I think we need to investigate everything that will act as a form of early intervention and not get people into crisis, into breakdowns, which are so much more difficult for them and costly for the NHS to deal with. So I think that's just a really interesting thought. I mean, I don't know if anybody works for a small employer, if anybody has got any points they can share about what their small employer does. I have to say, the other thing I was thinking, sitting here listening to the examples, was the thought about workplaces. Your example, workplaces which are making people sick, which I think is the other example, the mental illness brought about by the very workplace and the practices in the workplace. So it's not a question of, adjustments, it's a question of, really changing so that the workplace itself isn't causing a problem. And I don't have an employer at all, apart from the many thousands of people who voted for me, and they're not much use in some of the things we're talking about. And we've had some very serious mental health issues in Parliament because of the sheer stress of what's happening there. I mean, stress that is pretty hard to see, but not just the 3 years we spent on Brexit when we should be doing other things, but the fact that there's so much abuse level. So I mean, I think that they're just interesting points about social media that were made earlier. Hopefully we will learn something good will come out of this, all the sort of death threats and abuse that get levelled at MPs. But we don't have an employer, so we need to come up with a solution to that point you're raising. What to do when you're a small organisation, or like 650 MPs, they don't even have an employer? Are there ways that the organisation around that could put something into place that would support people and mentoring just like
I think the lady we have, and then you, sir.
Hiya, I wanted to go back to what Kate was saying at one point about young people losing out on quite a lot of things recently because of cuts. And this has become really relevant to my sister, who is studying at Keeley University, and she's had to take a year off for mental health, and then she's still having all kinds of other problems. And she's actually asked me to raise that. What do you do when the university is even stopping their requirements and their services? That Keele this week, a week before term starts, has just said that they are going to close Nightline, which is part of the national organisation that trains the students themselves to offer peer support, and it's always been very popular at Keele. And naturally the students really want to do something about it, but the university is quite firm that for reasons we're not quite sure they won't do it anymore. And we're asking what can you do as a student, as a person, as families, what can you do to fix that?
I completely agree. I remember when I was at university and I got there and I had no idea how much of a lonely place it would be. No one prepares you for it, no one talks about it, and even when you're there, you've just got to attend this whole fun and games and enjoy Freshers Week. But actually, it's a huge change for a lot of people who might not be prepared for it. And if universities are there to support you, you get people dropping out of university and potentially not fulfilling the potentials that they could have had if they had that support. I went to Edinburgh University and there was a big consultation it was last year actually, about whether parents should be informed if a student is struggling. And that sparked a really interesting debate on the campus about it. And it was really good to see because it never happened when I was there. And it's steps like that. I think universities have a long way to go. But you can shape it and get involved in the students' union and talk about and raise these issues. It's the only way students' voices will be heard on campus. And Simon will probably reflect on that more than me from his NUS experience. But I genuinely think that the students themselves, talk about with your friends and after lectures or you going out and actually having that conversation. Are you struggling as well? So am I. Let's actually do something about it because there's people out there that don't have those friends to call and talk to. And I think it's even more of a problem for young people as well. My sister's a teacher. She's teaching year 6, and the amount of kids that come up to her who are struggling with their mental health and said awful things to her. And she just goes to her teacher and says, we need somebody to come in and talk to these children about their mental health. Because a lot of them are going home and don't have the home environments to support them either. And the wait time is 6 months. And if these children are struggling at primary school, when they get to university, if they get to university, the problem's not tackled and it's only going to get worse. So education, I think, is crucial at every stage, especially university and even at primary school.
And if you want contact details for the Keele Student Union people, we know various people, I'm sure the Student Union are on the case around Nightline, given who the Chief Executive of the Keele Student Union is and who the Presidents are, so I can give you their contact details, that's helpful.
We had I can report, we had a very positive meeting. There's an all-party parliamentary group of MPs on universities. That's a group that exists and meet with vice chancellors, but to discuss student mental health. Because an awful lot of universities, and it sounds like Keele might be one of them, are struggling because that transition point in life where you sort of leave home and go to university is a point, you know, as being said, where, you know, loneliness, isolation, money problems, you know, all the stresses come together. And the NHS doesn't cope with it very well. I mean, there are even stupid things like you have to decide where you're registered with a GP. And if you're keeping your registration at home, GP registration at home, you then can't register for services where you are.
There's a huge amount of exploitation, there's a huge amount of bullying, there's a huge amount of mental health issues, and the big broadcasters turn a blind eye to that. I think that's the second point is, how can the big organisations on their supply chain influence and actually change behaviours by the suppliers and not just ignore them?
Yeah, you must have my list in front of you there. So supply chain management, we worked quite hard, and at the beginning, if we talk about assessments, yeah, so I recall 5 years ago in a conversation with the executive team saying, we all get access to our Bupa medicals. Is that because we're more important, because we're senior managers? Is that because we're more important than the receptionist or the plant fitter out on the site? Well, of course we're not. So the medical assessments, everybody in Thames Water gets access to an annual personal confidential medical assessment every year. 30-minute face-to-face consultation with a medical professional. That deals with both physical and psychological questions and testing. And it's remarkable what comes out of that. Now then, on top of that, if you work across our capital framework, everyone gets access to a personal medical assessment. That's about 6,000-7,000 construction employers. You work across our infrastructure, everybody gets access to a personal medical assessment. And it ripples through the supply chain. And the way we've orchestrated that over the years has been through a suite of essential standards. These are contractual obligations across our supply chain. And when we set our stall out, is if you want to work on behalf of Thames Water, you will meet this suite of contractual obligations. So large organisations can have a massive impact. And people say that, you know, well, you're a big company, you're able to do it. It costs 50 quid to MOT our vehicles. It costs the same 50 quid to MOT our people. Now then, you start then to make it, if you're an SME, suddenly it starts to be, wow, really, you can do that? You know, and we've got examples of small organisations who are giving annual personal medical assessments to their employees, picking up physical and psychological issues, and actually getting them then help and support. From a health perspective, you know, why wouldn't organisations do that? I think every organisation should look towards doing that, and many are. The reason is NHS is there not to NHS is there to prevent illness. That's its vision, not to treat and cure. But that's what it ends up doing. As a result of business can do a lot more, in my opinion. So we've had over 10,000 assessments, and to give you some idea of stats, yeah, 180 people that we've told to down tools go straight to A&E because, you know, high blood pressure's off the scale, cholesterol. I've had 108 abnormal results for cancer testing, both prostate and bowel cancer testing. You know, 14 people have phoned me up and said, thanks very much, you've identified I've got cancer. But they're then getting access to hormone and radiotherapy as opposed to chemotherapy, and they're in work. So what an impact it's made across the organisation, and then into the supply chain, enormous. because we've had organisations change their thought train around how they provide access to clinical care through their companies. It can be done.
Ladies and gentlemen, I've been given the nudge that the clock's against us. So if I could invite my panel to just say a few words to wrap up. Shadow Minister, can I start with you?
Well, I'm sorry I was late, I suppose I should say, because I obviously missed some very interesting input that was given, but I think the questions have been very lively. I think we're just at the start of understanding what we can do, and I think it's great to hear from Thames Water and the Community Union about the good practice. But I think we've also had some really useful suggestions that I think I need to take away. But I think we definitely have got to focus on, as I mentioned, there's a possibility that we can get into a mental health revolution, that we can ensure that workers and staff know their rights and insist on their rights and can get the adjustments. But I think suggestions for working through what we might do for small employers, what we might do in the sort of gig economy or the freelance economy are all part of that. So I'd like to thank the other people on the panel for what I've picked up from since I've been here, but also to assure you that we will be, Labour government will be the first government with somebody in the shadow, in the cabinet, tackling mental health. Despite our example 2 or 3 years ago, the Tory government has never promoted the role of somebody with mental health, and it's looking after mental health as a minister. And it's vital that we have that, because so many of these issues go right across departmental portfolios. There's no point in having just a person that is not able to cut across, because what we're hearing here tonight is what business can do, what industry can do, what unions can do. So it's as vital that I talk to people like Becky Long-Bailey and other colleagues about those things, and that we have somebody keeping an eye on this all across government. We've lost, for instance, there's been a focus on women this week from the point where we were talking about the menopause and making workplaces menopause friendly, and that is a fluctuating condition that we should be taking account of. But it's important to remember that the last Labour government did have a women's mental health strategy. So in some cases, having that role right at the top of government in the cabinet really shows how important it is. But also the commitment that we saw a couple of weeks ago from Jeremy to have rights at work as at the heart of a Labour government too. So things will get better, I guess we say. And I think that the final question is resources, tackling the workforce problems which stop people being able to get therapy appointments and treatment when they need it, and not having these hidden waiting lists, which are such a horrible factor in mental health. I don't use the word parity of esteem because I think it's become devalued because it hasn't happened. But we've got to stop having so much war words and rhetoric around, the burning injustices of mental health, and just get on with action as people in this panel have been doing.
Karl, can I?
Keeping it very brief, I'll finish where I started. I think through good leadership, good education and good engagement, organisations can create a culture of care and an environment that supports positive mental health within its workforce. And that ultimately will lead to illness reduction from work-induced illness and in our case also from non-work related illness absence as well that we've seen, which is extremely encouraging.
Kate.
2 things. If you're in your workplace and it's unionised, contact your rep. If you don't have a rep, become a rep. You don't understand the importance it can have in actually changing your colleagues' lives at work, and you might be the person we trust you can approach, and that can make a huge difference. And secondly, if every employer was like Karl's, I think we've cracked it. And thank you.
And finally, Simon.
I guess thank you very much to everyone for joining us and start having the conversation. I think let's continue the conversation wherever you are, whoever you're with. Be courageous in talking about things in the same way. And big or small employers, there's always things that people can do. And at the heart of this is about humanity. Actually, it's about, it is about workers' rights, but it's also about being human with each other in the workplace and ensuring that work is nourishing and enriching rather than depleting. So I think that's really important. There is a mental health gateway, which is a website full of resources for employers primarily. If you don't know it and you think your employer could do with some guidance and advice, there's a gateway which provides all of that advice. If you want to, we have a manifesto over here, which if anybody wants to sign up to, then please do. And then finally, there will always be an email, there will always be another meeting, there will always be other things for us to do, and actually we also have some control and some agency in some of the things, even when there may be things that seem out of our control. And I would just encourage all of you to think of managing your work as best you're able to as a radical act of self-care and self-importance, and do what you can to keep it in its box, not look at your emails at 9:30 or 10:30 or 11:30 whenever you go to bed. And talking of self-care, there is some wine left at the back if any of you indulge in wine as self-care. Please do drink it, we've paid for it, we've got the room till 8 o'clock. Thank you very much.
Thank you so much indeed.